oral health presentation. I'd just like you to note this statement here. It is likely that the child with poor oral health is likely to become the adult with poor oral health. This is why it's so important to embed these messages in to your settings as early as possible. Just a little introduction to our oral health team here at Community Dental Services. There's myself, and I've got Jodie, who's presenting with me today, and Holly. Holly and Jodie are both clinical nurses within the CDS team, and myself, I manage our small team, and we are a very small team, and Lincolnshire is a very big area, but we do try and get around the area as much as we can. We work for Community Dental Services, like I said, who are a referral-only service. They treat those who a high street dentist does not have the capacity to treat. That's whether they are nervous, require sedation or general anaesthetic, could be medically compromised or have an additional need. Our team work out in the community, teaching others that care from birth right up to the end of life. And we also work at community events too, spreading oral health key messages. So the aim of today, what we'd like you to be aware of is how poor oral health can affect an individual's general health and well-being. You should be able to identify the main causes of tooth decay, understand how different lifestyle habits can affect your oral health, and have an increased understanding of the key oral health messages that we deliver. And these are all in line with the Delivering Better Oral Health from Public Health England. They are all research-based and evidence-based messages that we give. So what do we know now? There are inequalities in and disparities in health and well-being, and this is true with oral health too. Okay, there is a link between deprivation and disease, and again, this is true of oral health diseases. We'll look at slides further on where we can show pockets of the county that do have a higher tendency of dental disease. The main message I'd like you to read from this is that oral diseases are preventable. So majority of them, tooth decay, gum disease, they are all preventable, things that we can do at home. Just small changes will make a big difference. In reality, no one agency can take sole responsibility addressing these oral health challenges, but together we can do more. So just to give you some facts on why these key messages are so important, between 22 and 23 in the UK, over 47,000 dental GAs, that's general anaesthetics, took place for 0 to 19 years old. That's a huge amount of children having a general anaesthetic for something that could have most possibly been prevented. 1 in 4 5-year-old children in Lincolnshire have got active tooth decay. Our team in Community Dental Services go around the schools doing epidemiology screening, and they have done a recent one, so these figures are going to be updated. But at present, there are still some quite high figures across the county. Like I said before, it's children living in areas of deprivation. They are 4 times more likely to get tooth decay. Now, this could be from, just lack of education generally, lack of access. And again, we'll just touch on that later on because we are aware that there is an access issue across Lincolnshire. And only 62% of 3 to 5-year-olds go to the dentist. Again, this could be, due to minimal access in the county. But again, we'll talk about reasons on the things that we can do at home, like to help to prevent this. Because if you're going to the dentist, a dentist can only treat what they're presented with. So if you are brushing well and you've got reduced sugar in your diet, then you're less likely to have any tooth decay. So it is important what we do at home. I just want you to make aware of the picture on the bottom left there. That's called the jar of teeth. It's from a clinician called Claire Stevens. and she's a paediatric dentist over in Manchester, and she runs what is the Tooth Fairy blog. All those teeth out were taken in one session in theatre, where children were having teeth removed, mainly because of dental decay. You can see on some of the teeth there, they've got some really nasty black areas on them. 16 of these teeth were from a 2-year-old. So it really is something that could be prevented, and that child will be growing up in really important years, and not having any teeth. So the impact of poor oral health within children. It's got a poor start in life. So if a child's got toothache or lost a lot of teeth, this is going to affect the child's development, the nutrition and speech. They're not going to be able to eat certain foods, and the speech, if they've got teeth missing, they won't be able to pronounce the words. They may be embarrassed and not being able to, be confident to speak out and socially interact with others. This can then affect their well-being, give them lower self-esteem and confidence, and also phobia. What we would recommend that if anybody was very dental phobic and this was putting them off taking their children to the dentist, just advise that somebody else can take them on their behalf, as long as they've got consent to do so. It's much better to having another family member to take your child, rather than yourself if you're very, very nervous. Want to make sure that they're ready for school absence and school attainment. This is growing numbers in children not attending school due to having toothache or many dental appointments. So it is really important that if we keep the mouth as healthy as possible, it will help in all these situations. Parents and carers taking time off work to care for the children that have got toothache. Again, this is going to affect, families' income and the local economy. But more so, that child's going to be in pain. Toothache's not very nice. It is one of the worst pains. And children get that pain too. As you can see on the image there, this child's got a very, very swollen face. So all that infection is going to be very painful, and it's going to make them feel generally unwell. If untreated, that could lead to things such as sepsis, and they're possibly highly likely to need the teeth extracted under a general anaesthetic, which again, general anaesthetics aren't something to take lightly. Also, dental neglect, and there are wider safeguarding issues. Let's talk a little bit further. So, dental neglect can be defined as the persistent failure to meet a child's basic oral health needs, likely to result in the serious impairment of a child's oral or general health or development. Now, the key word there is persistent. Okay, so we're not kind of, looking out for one-offs, things like that. It's if if they've got persistent dental issues, or they're not turning up at the practice, to dental appointments, that's when issues can start to arise. So what we need to make people aware of is that if a child doesn't attend for a dental appointment, they are classed as being was not brought. Whereas if an adult, you just be like, they did not attend. But a child is was not brought. That child cannot get themselves to the dental practice themselves. So 3 was not brought can be a red flag, because that's when it starts causing a safeguarding issue. So it's not to kind of get anybody in trouble or anything. It's just to support the families and support the children, because the children have got a right to have oral health, have good oral health, and it forms a part of the general health. So it's really important that we get to look after the children's teeth. So looking at this picture here, you can see the obvious signs of decay, can't you? We've got 2 rather large abscesses, and there's quite a lot of decay going on those top teeth. So things like this are things to look out for. So you can what we call lift the lip. Just have a little look. So if a child is complaining, or they're looking unwell, they've got a swelling, you can just lift the lip. And if you do see something, just highlight it to the parent or the carer. And And just maybe just keep a record, make sure that, just ask them the next time you see them, if possible, oh, how did they get on? Did you get them seen? Just little questions like that will make a big difference, and encourage them to, look into getting some dental care. Because it is a safeguarding issue, it would be worth recording it. So if you've got a safeguarding lead in your setting, just note anything that you've seen, anything that you've said, note it all down. As I say, you were there to protect that child. So looking at some statistics, this is why, why we want to get these messages out there, because this slide shows the percentage of children who showed decayed experience. So if we look at the red bar to the right, you can see that 23.7% of children across England shows prevalence of decay, with the East Midlands and Lincolnshire being comparable to this. When looking at each district, however, Boston shows a higher prevalence rate than the majority of Lincolnshire. East Midlands and England averages with about 39.3 of the children sampled showing signs of dental decay. North Kesteven is significantly lower than in the Lincolnshire and regional averages. So the link does show that there is a prevalence of decay in areas of deprivation. And therefore, this is what we want to ensure that we're, looking more into these areas to prevent this getting any worse. I'm not going to dwell on this one too much. This is just a map of, at present, what areas are fluoridated and not fluoridated. So when I say fluoridated, it means we get an added amount of fluoride added into our water, just the household drinking water. So the green on the west side of Lincoln is fluoridated and the white areas are not. So if we look at the previous slide, you can see that the areas like Boston that have got the higher levels, they're in areas where they're not getting fluoride added into the water. This may or may not have a difference, but we do see it in other areas where we get similar results. So it is worth just having a look on the Anglian Water website. There's a little link to it here, and just seeing if you're in an area with fluoridated water or not. So I mentioned before about how we can, check about if teeth, what's kind of some things that we can look out for. So on this one, this image here shows nice healthy teeth, nice, the gums look really good. They don't look swollen or red. The teeth look nice and healthy. This next one, I don't know whether you can see, it's quite a small image. The areas where the arrows are pointing to, they just look a little bit chalky. They look a little bit darker white than the other parts of the tooth. Now, these are called white spot lesions. These are just the start of decay. The chalky shadows are white spot where the enamel is being weakened, but we can stop this from progressing if we resume a good oral health routine. So looking at this can be stopped and it wouldn't progress any further. If we weren't to brush very well and have a high sugar and acidic diet, it would then move on to this, because these are brown spot lesions. So the bacteria has gone through the enamel. So the enamel is the outer surface of the tooth. That's the hardest substance in your body. It's harder than bone. So for it to work through this, that's some going. So on the outer surface, we can see kind of like small little flecks of brown, but underneath that, the tooth substance is much softer. That's your dentine. And what happens is you might think, oh, it's just a small hole, but underneath that hole, it mushrooms out underneath and the decay spreads much faster. This would then lead to advanced decay. Okay, so this is obviously teeth that have really progressed and decayed right up until the gum line. As you can see on this one, the bottom teeth look really quite healthy, don't they? And it's the top teeth that are looking more decayed. We often see this with children that drink a lot of juice, sugary drinks through bottles, that constant kind of flow of sugary substances flushing over the teeth constantly through the day will eventually turn your teeth like this. Okay, so this child would probably need all those teeth that you can see are decayed extracted, and it would be very painful, and they won't be getting any of their adult teeth through for quite a while. So that's going to affect the speech and things that they can eat. So it can go from the white spot lesions to advanced decay rather quickly if we don't stop it. Okay, so looking at brushing, best time to brush before bedtime. The main reason for this is through the night, our saliva flow in our mouth reduces. And what our saliva does is it helps to neutralize any acids in the mouth, flushes away any debris of food or anything like that. And it just helps to help your teeth nice and moist. Through the day, we produce about a pint. Through the night, we produce about a teaspoon. That's why sometimes you might wake up and have a bit of a dry mouth. So it's really important that last thing at night, we make sure our teeth are super clean, and then they're less risk overnight then because they're not getting the support from that extra saliva. We want to brush teeth in small circular motions for 2 minutes. Spit out any excess toothpaste, but don't rinse. It's really important that we keep the toothpaste on our teeth as long as possible. It's a bit like if you want to put hand cream on. You wouldn't put hand cream on and then wash your hands. So the toothpaste that we're putting on contains fluoride, and that fluoride seeps into our teeth and it helps to protect that nice outer surface, the enamel, keeps it nice and strong. Use a small-headed brush, okay? Smaller head the better. Our mouths are very small and they don't need a big brush to get around to do it. So some people think, oh, use a nice big brush it really quick. It doesn't work like that. Nice small-headed toothbrush, and you want to be brushing about 2 teeth at a time maximum. Replace the toothbrush once the bristles have become splayed, or every 3 months, or unless you've had an illness, things like COVID, D&V, any throat conditions, anything like that. You're better to change your toothbrush just to stop any reinfection. Children under 8 should be supervised. We always say that if a child can tie the shoelaces, then they should have the dexterity to brush their own teeth. And interdental cleaning, things like little brushes, floss, can be introduced from 12 years. The next slide will have a toothbrush video on, which you can watch at your leisure. So, again, delivering better oral health key messages, like I said, just brush last thing at night. Use a pea-sized amount of fluoride toothpaste. Okay, you can see on the image the children 0 to 3, it is just a smear, but 3 up to adults, it is just a pea size. We always recommend really smushing that toothpaste into the toothbrush. That just helps making sure that every tooth in the mouth gets you know, some of the fluoride toothpaste on it. Spit, don't rinse. Even with mouthwash, we recommend using mouthwash at a different time to brush in. Your toothpaste, as you can see there, should contain about 1350 to 1500 parts per million of fluoride. Mouthwash is on general about 220. So again, we don't want to be rinsing off our you know, all the lovely fluoride content of the toothpaste with a lesser fluoride content mouthwash. Mouthwash is great for a different time of the day. So maybe when you come in from work and from school, just use your mouthwash, have a little freshen up with that. And again, change those toothbrushes every 3 months. So the toothbrush packs that we're delivering with all the HAF clubs, they're also available at children's centres, the health visitors, you know, lots of places across the county. So it's always worth explaining to families that they can always get more as long as they're available. So we've talked about toothbrushing. We're going to have a quick look at diet. So it's your toothbrushing and your diet that are the main things that are going to keep your teeth nice and healthy. And really, it's quite simple. We want to reduce the amount and the frequency of sugary foods and drinks. Okay, so if we look at this diagram here, okay, all of these are factors, all of the outside circles are factors for this little sad tooth in the middle. He's got tooth decay. So for tooth decay, we need a tooth, we need time, we need sugars, and we need bacteria. Okay, so if we remove one of those factors, then we reduce the risk of dental decay. What we don't want to do is remove the tooth. We really want to keep that. So time. How long are our teeth under attack? How long are the sugars and acids being left on the tooth surface? So time is something that we can reduce. Can't fully remove it, but we can reduce it. Bacteria. Even after brushing our teeth, bacteria is still present. Again, we can reduce the bacterial load by brushing regularly for the full 2 minutes, and that will help reduce the bacterial load. And sugars, okay, this is one thing that we can, almost fully remove. So we can choose much better options for our teeth than foods and drinks with sugars in them. So how does decay happen? Okay, why do we want you to stop, and reducing the sugary things in our diet? So what happens is when we eat sugars, they feed on the bacteria in our teeth. So like I've just said, even after brushing, about 20 minutes after, that bacteria load just starts building up slowly and slowly. Okay, so any sugars that we eat, they feed the bacteria. This then ferments and then makes an acid. Okay, and this acid then damages the tooth surface. Now you remember I said before that the enamel is the hardest substance in our mouth, in our body. So the acid is like doing quite a lot of harm. Over time, this can cause a hole. Okay, so it won't happen overnight and it won't happen in a week, but over time, with persistent eating a lot of sugary foods, this is going to cause an issue. Okay, so looking at this diagram here, this shows how our mouth can stay healthy when we're eating and drinking. Okay, so this is all, it's called the Stefan curve, okay, if you wanted to look that up. So basically, our teeth can take up to 4 acid attacks a day. Okay, so here, if you look at the first dip, that could be your breakfast. You could have your toast, cup of tea or juice, the lunch, you're having your whatever you're going to have for your lunch, and then your evening meal. And one more snack, and our teeth would be, fairly happy with that. Because our teeth are spending not much time in this danger zone. Okay. We want to keep them in this neutral acidity. So if we look at this one, this is where we have got, you're having your breakfast, morning snacks, you could have a cup of tea, then a bit later, they could have a glass of orange juice and a biscuit, and then lunch could be having fruit yogurts, things like that. Afternoon snack, a packet of raisins, and another glass of juice. So as you can see, all these like different foods spread out throughout the day, our teeth are in that danger zone for a lot longer, and that is when you're at a higher risk of having teeth damaged. Okay. When we look at these images on the right, these just show recommended daily amounts. Okay, so 4 to 6 years, they should be on 5 cubes of sugar. 7 to 10 years, about 6 cubes of sugar. That's about 24 grams, and 11 plus up to adult, 7 cubes or 30 grams of sugar. Okay, so we're going to look further into what different foods and that how they affect us. So, how much sugar? These are some quite regular things. Okay, so if you remember at the bottom, you can see along there how many amounts we should have. So firstly, if we look at a medium McDonald's milkshake, there are other milkshakes available, but a medium strawberry milkshake, that's got 57 grams of sugar, so that's 14 cubes. You're already double what an adult can have just in that one drink. Okay, your Volvic touch of fruit for a 500 milliliter bottle is 2.3 grams of sugar. Now, you are well below the guided allowance for a 4 to 6 year old with this one. However, a lot of people think, oh, it's clear, it's healthy, it's got just fruit in it, but we'll explain why this has got sugar that harms your teeth in a little bit later. Fresh orange juice. Okay, so within 150 ml, this picture's showing a 950 ml bottle, but 150 ml, it's got 12 grams of 12 grams or 3 cubes of sugar. Okay, so in that whole bottle of 950 ml, that's 74.1 grams, 18.5 cubes. And again, I'll talk about why this relatively healthy drink has got these sugars in it that will affect our teeth. And your Mars bar. Okay, so per bar, we are looking at 31 grams or 8 cubes again. So that's nearly, well, that's just over the amount for what an adult should be having per day. Okay, so these are probably extremes that we've looked at. However, they are quite common, common foods. So what about no added sugar drinks? Okay, we get asked this quite a lot. So sugar-free fizz is still bad for your teeth, okay? Because the fizz in the sugar-free drinks is what's acidic, and that's still going to cause what we call tooth erosion. It will wear that lovely strong enamel away. Okay, so even if it's not got sugar in it, the fizz in fizzy drinks will have. It's slightly different for totally sugar-free juices. But one thing we have to be aware of is when it says it has got added fruit juice from concentrate. That is basically another name for sugar. Okay, so these are naturally occurring sugars, but they are classed as free sugars, which cause dental decay. Okay, and these drinks are also very acidic as well. So these drinks you can have with your meal. Okay, so we don't say no for any food or drink, but if you think back to that diagram about the time and also that Stefan curve about how many acid attacks, if you're having your drinks and foods like the one we've talked about previous with your meals, that's still keeping to those attacks to 4 times a day. So it's much better to have your, if children are coming into the settings wanting juice, have it with a meal, and then throughout the day, water. It's water and milk, but water mostly, because sugars get called a lot of different things. Things like molasses, caramel, invert sugar, glucose, maltose, dextrose. All these different types of sugar are going to cause damage to your teeth. Just to explain a tiny bit more about the fruit juice. The sugar that's in fruit that occurs naturally is fine if that fruit is whole. So a whole banana, a whole pear, a whole strawberry are fine. However, once that fruit is changed, so be it macerated into a smoothie, be it dried into a raisin, that's when the encased sugars are freed and they then become like dangerous to teeth, really. So what we want to do is limit these to meal times only. So what can we have? So we've got your usual, like I said before, we've got our tooth-friendly food and drinks. We've got our whole fruits, water is brilliant. Cheese is fantastic because it helps to neutralize those acids. That's why you find that often cheese is eaten after a meal. So if a child is having a lot of like sweet and fizzy drinks, a little bit of cheese after would help greatly. Plain yogurt, and add your fruit to it. Flavored yogurt, remember they've got that fruit that has been changed. So because that fruit's been changed into a fruit flavour in the yogurt, that's when it causes damage to your teeth. But if you had a plain yogurt and added whole fruit to it, teeth would love it, it's fine. Popcorn, but remember not to have it the sweet version. And things like rice cakes, you know, you can put peanut butter on, things like that, that'll, you know, like hummus, they're a great addition as well. So what I'd just like you to do is look at these two menus. So we've got a day 1 and a day 2. They're both quite comparable. They've both got a sandwich on it. They've both got a potato and a fish option. Bit of fruit, juice, cereal, okay. But when we look at the differences of the sugars, day 1 has got the total amount of sugar that a 7 to 10-year-old should be having, so that's 24 grams, okay. Day 2 has got 87. It's got 3 times the amount that a 7 to 10-year-old should be having. The main difference is here, what you can see is the snack, the morning snack. Day 1 was a nice banana. Remember, that's a whole fruit, that's fine. The day 2 has got a tracker bar. It's a cereal bar. So they're often covered with like honey, dried fruits. All those are really high in sugar and damaging to your teeth. And the main one here is the smoothie. Smoothies become really, really high in sugar. Okay, so this is one reason why we recommend water only, and then have any things like smoothies, any fruit juice, anything like that. If they do insist on having them, have them with the meal, and offer water anytime separate. So again, I think that one's a really important one because they are both fairly similar, but just small changes can make a huge difference. Okay, I'm going to pass on to Jodie now for the rest of the presentation.
Lovely, thank you. So we're just talking about here, so visiting the dentist. As we said at the beginning of the presentation, we do appreciate that at the moment across Lincolnshire and pretty much England itself, that access to NHS dentist is very limited. They're doing a lot of work in the background. I know it doesn't seem like it, but they are. And hopefully we'll start to see some differences coming soon. However, you know, if you are lucky enough and you are visiting the dentist, then obviously visit the dentist as often as they recommend, and that can be every 6 months, yearly, or if they think that you're in need of a little bit more help and intervention, they'll recall you sort of like 3 months. So what can you expect when you go to see your dentist? So there is the free fluoride varnish from age 3. So as you can see in the picture there, it's an application direct to the teeth there of a fluoride varnish. That's applied sort of twice yearly, or if the dentist sees fit, they'll do it sort of quarterly. So every 4 months they'll see. And it's just a direct application of fluoride, keeps the teeth protected and nice and healthy. And obviously, if you are struggling with NHS dentistry at all, there is the NHS website there, and that will help you to find an NHS dentist. Pop in your location by postcode, and it will bring up a list of everywhere that is taken on. So as Jane said at the beginning of the presentation, we're within Community Dental Services. We do look after a lot of our patients with additional needs. So if you do have children within your settings that have additional needs, you will find that they may suffer from dental decay and other problems in the mouth a lot more than somebody who wasn't. That's mainly because of the challenging behaviours. So maybe parents are struggling to brush their teeth. They don't like flavours. They have sensory impairments to a lot of things, communication difficulties, so not the understanding of why we're brushing our teeth, or, you know, even foods that they're adverse to, physical disability. So actually the physical element of brushing teeth that they'll not like or enjoy, and learning disability, which comes with itself with problems and difficulties. So some top tips that we'll share with you that may help. So we've got there just brushing, so small headed soft brush, which Jane mentioned before. So that's always easier for access into small mouths and things. A lot of people tend to buy their toothbrushes because they're marketed age related. That's not necessary. A small headed toothbrush is always better. Diet, obviously just keeping diet to a minimum, so cutting out them sugars where you can, promoting the drink of water when you can. You'll find you might come across some people that are peg fed, so obviously that's nothing orally at all, and we would still recommend that, you know, brushing teeth is still important, although there's nothing going through the mouth. Sometimes it doesn't promote saliva, or sometimes they over salivate, so that can cause itself a buildup of plaque because there's lots of salt and minerals within our saliva. So we would always say continue to brush, but perhaps use a toothpaste without the foaming agent in, so that would be easier for them with spitting and getting the foam out in the toothpaste. And then visiting the dentist as often as you can and what is recommended. So just moving on to the next one there. So you might find people within your setting that have braces. So you probably find from usually about the 11 that children start having braces. And again, it's just a quick recap really of just ensuring that what they're bringing into your settings is the correct foods and drinks to be having. Certainly they would have been given their own diet advice by their dentist and orthodontist, but if you do notice they're coming in with sticky sweets, chewy sweets, and, you know, fizzy drinks, just sort of guide them to the right areas to say that, you know, maybe swapping them fizzy drinks for water would be better for the teeth, and definitely having a healthier diet of fruit in a whole form and vegetables and things. So just covering some subjects now that may not be completely relevant within your settings, but we do think it's important just to highlight some of them. We do, unfortunately, within the practice and in other areas that we've been to talk to people, that from about the age of 10 and 11, there is some children that become curious about smoking itself. So obviously, you know, where you can within your settings, do discourage it, as we always do with adults as well. Just sort of, you know, bring to highlight that of them that smoking does bring itself with bad breath, can discolour the teeth, it alters the taste and smell. It will also promote gum and bone disease, which then eventually can cause tooth loss, and it does slow down healing. So when our gums are not brushed properly and effectively, they begin to bleed, and that's our gums saying we need to continue brushing. For people that smoke, the bleeding in the gums doesn't happen because the smoking itself does stop bleeding. So therefore, they wouldn't know that their gums are perhaps need a bit more attention. Moving on to the next slide, which has become very popular, unfortunately, with the young people today, and that's vaping. So Jane and I are looking continuously at new research and new updates about vaping, but at the moment it still sort of screams the message that, you know, vaping is better than smoking, which in a healthy impact of, yes, at the moment, yes, that is, but unfortunately it's become something popular for young children just to start vaping. So again, it's just giving them messages just to say that we're not entirely sure of the long-term effects. It does cause dry mouth, and from other slides that we've had before, dry mouth, that can lead to eventually tooth decay because we're not having enough saliva in the mouth, we're not moving things around, we're not keeping our teeth healthy. Again, bad breath, again, gum disease, which is the same as smoking, and it can lead to caries and decay, again, because of the dry mouth. So our advice there would be, if people are vaping, to make sure that they're doing it safely at least, and they are drinking water in between vaping, and they're keeping vaping to a minimum, not having it every couple of minutes and things. And again, like I've said before to the previous slides, you'll probably think it won't be relevant within your settings. But again, you do have that age bracket where they can become a bit inquisitive of it. And again, with parents, you can also advise as well on alcohol with parents, smoking and vaping. So we're just saying that obviously alcohol is very high in acid. So again, it comes with having the fizzy drinks of that acid attack, weakening the enamel on your teeth. It's very high in sugar. And the fact that if you are going to drink it, have water in between, and then drink through a straw where you can. And then we would always advise waiting sort of an hour after your last alcoholic drink before brushing your teeth. So again, just looking at the effects of drugs. So you can see from there in that picture that them teeth really aren't in a good way at all. And this is the effects of long-term use of drugs can have on people's mouths. So obviously, people who take drugs, we know that then increases their sugar craving. So they'll be looking for the sugary things to eat all the time. Again, it can cause dry mouth, a lot of jaw clenching, which can be traumatic for the teeth. And we do find quite often that people who are taking drugs, brushing their teeth and just genuinely looking after their own oral health and general health is really low on their things to get done and do. So obviously that comes a detriment effect as well. And also trauma, and that's more to, if people have been taking drugs, they're more prone to accidents, and we're talking sort of falling over, they're not steady on their feet, or even in some cases, fighting and getting themselves into scrapes and bother like that, which obviously fighting can come with its own sort of traumas if they happen to have mouth trauma. Something again that's quite out there with the research and in the news and everything is mental health, especially in young people. And as we've seen that the link usually to dental health with mental health is that people that's suffering from mental health tend to avoid dental care so much that their oral hygiene is neglected. This can result in gum disease and tooth decay. So people tend to just not have it high on their agenda to look after themselves in that way. So if you do see somebody that usually was, looking after themselves in quite a way and now they're not, again, we're looking at possibly going to your safeguarding lead and just saying, I think something's going on, having a chat with them, seeing if there's something more you can do to help. Very much that's going to be probably more within your settings, and the children you look after is looking out for signs of sort of bulimia. And this is when people make themselves be sick after eating. And obviously, if you're sick, that's high in acidity, and that can cause dental erosion as well. Low levels of calcium are also common, and this can affect the health of the teeth also. And some people just might require a bit of motivation from others to help look after oral health needs. This can include daily reminders and encouraging them at different times of the day. And obviously, some of the effects from the antidepressant medicines, they can cause dry mouth, which, as we've said before, can lead to dental decay. So what can we do? What can we do in the setting? So we can talk about why we brush our teeth, which going over the slides again that we've been through today, what we use to brush our teeth, why fluoride toothpaste is important, and that, all important one to finish off, spit, don't rinse. We can talk about diet like we have done today, talking about the good foods and the bad foods, or always and sometimes foods, sugar activity. And then it's always good to sort of introduce a food diary, and then we can all sit down together and have, check the sugar content for the day. Like we've spoken before about all them hidden sugars, you'll be surprised throughout the day of how many hidden sugars are there and how frequent we are having them. And then just to recap everything we've been over again, so our key points: brush twice daily, especially last thing at night, use fluoride toothpaste, spit, don't rinse, encourage healthy lifestyle habits, reducing the frequency and amount of sugars, and then visit the dentist as often as they recommend. And then just moving on to this one. So let's make every contact count. So us talking to you today, you will then obviously filter out, you look after the children that you look after. So you will then give them messages. They will go home, they'll speak to their family messages. So as you can see from that diagram, we're always filtering out and trying to get these key messages around as many people as possible will hopefully, you know, have that reduction of the dental decay that we are seeing in, especially in Lincolnshire at the moment. And like we say, with more of the contact that we've got, this will help while we don't have as many dentists as what we need. Okay. So just moving on to references here, so you can go back to these at your leisure after the presentation's finished, but there's just some references there where we get all of our store statistics from as well, and then there'll be further advice for you, and especially using the DBOH, which is Delivering Better Oral Health. That's a good toolkit to go back to and reference from. And then just a page there for resources and useful links. So we've got there things on like the Lincolnshire Health Family website, the NHS website, which I spoke about before, to find a dentist, the Delivering Better Oral Health again, and then the Change for Life, which is the website. You can go on to make different life choices. And then there's some other pages there that just help with toothbrushing aids and things like that. So we hope today after the presentation you have been aware of how poor oral health can affect an individual's general health and well-being, identify main causes of tooth decay, have a better understanding of how different lifestyle habits can affect your oral health, and have an increased understanding of the key oral health messages in line with the DBOH, delivering better oral health, for preventing tooth decay. So at your leisure, if you could either scan the QR code there, or there's the link at the bottom, and that will just take you to our feedback form. Any feedback would be greatly appreciated. It helps us improve our training and where we need to improve on. Yeah, everything. I just didn't have the link on my page, that's all. And I was thinking I've just had the link, but now I've seen it on yours, so that's fine.
Yeah, that's great. Thank you, Jodie. Thanks everybody for listening. If you've got any questions, our email's on that last slide as well. So yeah, thank you very much.
Thank you.